Would making childcare more affordable improve America's fertility rates? We know that as a nation, we're having fewer children and are ultimately not sustaining our own population. And I find myself thinking about this when reading about the Child Care Modernization Act. So this is a bipartisan bill. It's gotten a little bit of coverage. Obviously, there were a lot of crazy events in the last week, but it's gotten some coverage, and it's an effort to basically revamp a pre-existing program that was created in the 1990s in order to make childcare more affordable. Overall, this is a popular opinion among Democrats, Independents, and Republicans. They all say that the cost of having someone care for your child is too expensive. It's a burden on most families. So I want to walk through this act and some of the things that are being said about it, what it could do, and also talk about our overall increasing childlessness in America. Because I think that as much as we focus on the cultural reasons that people opt not to have children, I think often for families that want children, not having as many as they could is an economic decision. So let's get into it. So first things first, the Child Care Modernization Act would update the Child Care and Development Block Grant Program, which was created in the 1990s. This is from Congress.gov. I'm going to read you a description of the program. The Child Care and Development Block Grant Act of 1990 is the main federal law governing child care programs for low-income working families. The CCDBGA Act, not a snazzy title, I've got to say, from the 1990s. The act authorizes discretionary appropriations to support grants to state, territorial, and tribal-led agencies. Lead agencies use these funds to subsidize the child care expenses of eligible children and to improve the overall quality and supply of child care. So the Child Care Modernization Act aims to improve the distribution of this federal funding. It says effectively that we need to revamp how we are estimating the cost of childcare in order to better distribute it. Childcare in America is a major financial burden for most families. It is also increasing every year, and so it becomes a major factor when parents are deciding if someone will stay home, where they'll live, or, if they'll have more children. There's obviously a huge difference if you have to pay for daycare for, say, 4 kids versus 1. And I think this is one of the reasons that we need to focus on it as a major crisis. Now, I'm not saying that a federal fund is the best solution. I generally am wary of large government programs operating on the federal level. But I can appreciate that if we already have a program in place and we're not repealing it tomorrow, then that money should probably be governed to the best of our ability. If it can be distributed more effectively, maybe we should do that. So one of the nonprofits that supports this is called the First 5 Years Fund. I'm going to read you a couple of the reasons they are backing this effort to improve childcare through the Child Care Modernization Act. So First 5 Years says, working families with young children urgently need childcare support. The average cost of childcare today is more than $13,000 a year, by far the largest expense many families with young children face. 9 in 10 Republicans, 91%, think it's a problem or a crisis that Americans can't afford childcare, along with 91% of independents and 97% of Democrats. So this is a bipartisan bill, as I have said, but again, it reflects a bipartisan sentiment. This is becoming a crisis for American families. Now, you might say, if you're a Democrat, if childcare is too expensive and women opt to leave the workforce so they can stay home with their kids because, their entire paycheck is going towards daycare, then they are being limited economically. They're not going to be able to climb the career ladder. They're not going to be able to independently save for retirement, things like that. I think Republicans probably take a take similar to mine, which is like, if it becomes too expensive to care for your children, if you can't afford to become a one-income household and you have to pay for daycare and you opt to have fewer children because of it, that is a crisis for the family and for the fate of our country. The First 5 Years Fund also says that the Child Care Modernization Act helps to ensure parents have more options by increasing the supply of quality childcare in their communities. The legislation would help expand the supply, quality, and capacity of childcare options so working parents can find the provider that best suits their family's needs. It also continues to ensure parents can choose the type of childcare setting that works best for them, including licensed childcare centers, home-based providers, and faith-based programs. So again, It provides options, and it allows parents to choose based on what fits their needs in a high quality environment. I mean, you see really horrible stories of people whose children are harmed very seriously in daycare programs that maybe aren't credited, that are a little bit sketchy. And I assume parents opt for those programs because they have to, not because they want to, because the cost of childcare is really high. And so if you're thinking, well, it seems okay and it's less expensive than the other ones, I can afford this one and I can keep my job. I just wouldn't want any parent to be in that position. So again, it seems like a good step to make sure, especially for me, I think about rural communities, but anyone has access to high quality childcare. The first 5 years goes on to say the legislation strengthens childcare by working with states to design a more accurate way of determining provider reimbursement rates. CCDBG reimbursement rates paid to providers have historically not covered the actual cost of providing quality care. Under the bill, states will determine a, quote, cost estimation model to calculate provider payment rates, leading to more accurate and reliable estimates. States would have 5 years to make updates, ensuring they have ample time to adapt. I'm not necessarily trying to say that everything should come from the federal government, or that a solution started at the federal level is the best idea. But to me, this is reminiscent of Doge in a lot of ways. I mean, people were really mad about the idea that Elon Musk and his team of young men were coming in to say, hey, your agency is not working effectively and we should revive it. We should change it. We should maybe even close it down. But I think if we have a childcare crisis, we hypothetically have some kind of solution that's not really working, yes, we should revamp it. Maybe long term, this is not the answer. But for now, if we're already paying for the rebate program or the reimbursement program, then we should make sure the grants are distributed in the best way possible. Senator Deb Fischer, she's a Republican from Nebraska, is one of the backers of this bill. And she has said that not only would this address the expense of childcare, but also the gap in childcare. Because for a lot of families, it's not only expensive to send your kid to daycare, but your community may have only one or two, very few options. So you're not only having to get prepared to spend thousands on thousands to send your kid to daycare or to leave them with a relative or whatever, but you're also competing to try and find a solution. So if you don't get that spot, then what are you going to do? You have to change basically the economic fate of your family. She wrote in a statement on her page, too many working families live in childcare deserts with access to few or no childcare providers. The bill provides funding to states to expand the supply and capacity of childcare providers so working parents have multiple quality childcare options to best suit their family's needs. She also said that the bill would ensure childcare facilities are designated and equipped to keep children healthy and safe. Facilities and supply funding is time limited and authorized as a separate program outside the regular CCDBG program. Earlier this year, I heard a report from NPR, I believe, talking about a rural community in Wyoming where there was basically one daycare provider in an expansive area. And if the business became too expensive and the person shut down, or let's say they just want to retire, then that impacts multiple families. If you're dependent on childcare to be able to pay all of your bills because you need two incomes, then any sort of shift in the ecosystem could really hurt you. In an ideal world, I wish that more families could become single income, that they could, have moms stay home with their kids, because I think in a lot of cases that's good for mom and baby. But it's a tough world out there, and I'm not willing to say, well, we just should close down all daycares and that would be it. I think that there are solutions that need to be discovered, because people can't just be left in the lurch all the time. Again, especially if we are already funding a federal program that is supposed to help address this. So why is the Child Care Modernization Act relevant right now? Because we have a crisis on our hands. If our fertility rate declines too far, we ultimately cease as a nation, as do other countries. This is a concern actively being talked about in South Korea and Japan. We're not alone in this. But America's specific childcare crisis is the only thing in the purview of our lawmakers. And this really is the decision that parents are making. There are multiple surveys indicating that parents are looking at their future saying, we cannot provide for multiple children, and that they will reduce the number of children they're going to have because of the perceived financial barriers. The economic pressure is intense. I want to bring up this article from Time magazine published in June of 2025. It's titled, "Why People Around the World Are Having Fewer Kids Even If They Want Them." People across the world have been having fewer and fewer children, and it's not always because they don't want them. The global fertility rate, on average, has dropped to less than half of what it was in the 1960s, the United Nations has found, falling below the, quote, replacement rate required to maintain current populations in the majority of countries. Amid that historic decline, nearly 20% of adults of reproductive age from 14 countries around the globe believe they won't be able to have the number of children they want to, the United Nations Population Fund, the UN Sexual Reproductive Health and Rights Agency, said in a report released this week. For most of them, the report found it isn't infertility keeping them from doing so. They pointed to the factors including financial limitations, barrier to fertility or pregnancy-related medical care, and fears of the state of the world that they say are hindering them from making their own reproductive choices. The article goes on to say, the most significant barriers respondents identified in having the number of children they desired were economic. 39% cited financial limitations, 19% housing limitations, 12% a lack of sufficient or quality childcare options, and 21% unemployment or job insecurity. The prices for all kinds of goods and services have climbed precipitously in recent years. Global inflation reached the highest level seen since the mid-1990s in July of 2022, according to the World Bank Group. While it has declined since then, the current levels are significantly above those seen before the COVID-19 pandemic. If people do not think they can afford the children, they won't have them. Not true of everybody, but true of a lot of people. I've often heard of the car seat issue, which is, if you want to have 3 kids or more, so you want to have 4 kids, especially if they're all young at the same time, you need a bigger car. You have to buy 4 car seats. It is a significant investment. And if you only have 2, well, that's fewer. You can keep the car you already have. You can keep a smaller car that maybe takes less gas. Again, there are people who have lots of children and say it's going to be fine. Some of them can totally manage it. But for a lot of people, if we're trying to reduce the anxiety that comes with having children, which personally I think is natural. It's a huge step to bring children into the world. You're responsible for these little beings. Like you want to do your best to provide for them. I think we have to take the economic concerns seriously. And that's why I like seeing the Child Care Modernization Act. Even if a federal solution isn't my ideal, changing the distribution of funds that are already allotted to address this is important. And I think we need to create an economy that is pro-family. And this seems like a step towards doing this. Let me know what you guys think. Thanks for watching the videos. If you haven't already, please subscribe. It makes a huge difference for me as I attempt to grow. And I'll see you later in the week with another video.